Exactly. Yeah.
Now, what is concierge medicine? What does that mean? How is it different than your kind of garden variety primary care? What is concierge medicine?
So that's a good question. There's a lot of misconceptions about what concierge is. So the medical field, unfortunately, is fraught with a lot of inefficiencies, and there's a lot of difficulty seeing your physician, whether it's just too much need for physicians, too much demand for physicians, and it's created a lot of like stress for patients, whether they can get access to physicians.
Yeah.
And concierge medicine emerged originally to meet that need, to allow patients, generally patients who are more financially privileged, to access their physician at a more personal and accessible level.
Yeah.
And it's become a little bit more accessible for not even very well-off people. And it really depends what type of concierge physician you're looking for. You can find one that's right for you in your demographic or financial situation.
So everyone can relate. Listen, I'm at Kaiser, I have some sort of insurance. It's impossible to talk to my doctor. I keep getting the nurse instead. I have no actual way of reaching the doctor. And when the nurse tells me that they're going to send a message to my doctor, it might take like a week to reply.
Exactly.
So what is it like being a patient in concierge care? Like for your practice, do they it sounds like they have direct access for you, but you say more so like patients with financial means.
That's
so
right.
I imagine there's an additional cost there. So
that's right.
What's the added access and the benefit of having a concierge doctor?
So usually there's a membership fee of some kind, whether it's yearly or monthly, and the benefit is you have access to your physician directly. So you don't have the worry of how can I reach my physician? When am I going to see my physician if I need to see them? Whether it's the weekend, the night, doesn't matter. You're able to contact your personal doctor whenever you want.
Yeah.
And that's the specialty that comes with it. And patients are willing to pay for it because it gets rid of that insecurity about their accessibility. And I think that's where the value is. Basically.
Yeah, and if you don't mind me asking, I don't know if this might be too intrusive, but like, what does it cost? So I've been to your office. It's absolutely beautiful. You're in the heart of Beverly Hills. So what does it cost to have this concierge level care? Because I know you accept insurance.
Right.
So what does someone have to pay in order to access the concierge side of your practice?
The way we do it now is we're kind of leaning more towards a demographic-based cost. That means that people who are more medically intensive, usually we think should cost more versus people who are less medically intensive. And usually that comes with age. So someone who's an 18-year-old is probably going to be less medically intensive usually than a 65-year-old. So we think the cost being higher for an older person, so to speak, is reasonable.
That makes sense.
Yeah, so generally speaking, if you want me to give you a rough estimate, it starts around something in the range of $5,000 a year.
5,000 a year.
5,000 a year.
Now, what I have found and what patients have told me, again, we share a lot of the same patients because we cross-refer, is that the money that they're spending on their concierge doctor is an amazing investment and the return is immeasurable. If they have some sort of weird lab abnormality or some sort of test they're worried about, they get quicker care. It's helpful in preventing illnesses from progressing.
That's right.
And causing more problems, more impact on your ability to function, more trouble going to work. Now, I have, full disclosure, Dr. Benhuri is my physician. And what I have found is that when I am sick, and because I have this package and this concierge level care, I can get an immediate access to care, immediate access to the medicine I need, and it actually gets me back to work 3-4 days sooner than typical care. So it sounds like a lot, or maybe to some people it doesn't sound like a lot, but the return on investment is fantastic. Again, I got back to work 3 days, I'm guessing, based on like how my care usually goes and how often I'm sick. But I had a nurse come, I got IVs done, I got the Paxlovid when I had the coronavirus, and I got back to work. So it sounds like there's an upfront cost, and there is, but the return on that investment is great. Not to mention, if you have an actual medical problem that needs attention, if you're, God forbid, battling something aggressive, having direct access to your doctor and that concierge level care can be literally life-changing. I don't want to be hyperbolic here.
There's definitely situations where it is actually, and I've seen them. And I think if you're a busy executive, you're traveling a lot, you have demanding hours, and you want to feel like you can have access to a doctor whenever you need and not worry about seeing your physician when you want to, it's worth it.
Yeah.
For lack of a better, it's just worth it, I think, in my opinion, as long as it's not a financial burden for you.
Of course.
So I'm glad that you say that. I appreciate you saying that, because that's the kind of care I want to give my patients. I want them to feel like, they're getting the care that they deserve, that they need, without worrying about, whether they can get help.
Yeah, absolutely. Now, we posted on the social media, people have a lot of questions specifically for you. One of those questions that we got repeatedly was, what is it like to work with celebrities, really high net worth individuals, people in high demand? Now, we're going to get to that later. The first thing I want to dive into, being that this is like, a mental health podcast, is you serve as a mental health provider. Mm-hmm. A lot of patients, the first provider that they'll talk to about their anxiety, their insomnia, their depression, and their ADHD is their primary care doctor. You manage a lot of these patients. So I suppose what I'm curious about is, at what sort of severity of symptoms are you comfortable handling? And at what point do you think, hey, I got to kick it up to a psychiatrist?
It's a great question. Like I was saying earlier, our role as a primary care physician is the gatekeeper. Mm-hmm. So we're the doctor you come to first. So if a patient's having a mental health issue, unless they already have an established psychiatrist, usually, most of the time, statistically, they go to their primary care. And the primary care is actually generally trained to manage most psychiatric conditions within their scope. Mm-hmm. So I see a lot of patients who are dealing with a lot of anxiety in their life. They might be depressed. They may even have insomnia, which kind of plays into that. And ADHD is also kind of somewhat of an epidemic as well with the adult population at the moment too. So for me, that plays a part in the patient's holistic self. Mm-hmm. I think their mental health ties into their overall health.
Of course.
And I actually really enjoy taking care of patients who may have mental health conditions. And I generally try to keep it within my scope and not go beyond that, because I think psychiatrists are more, equipped to manage more complex psychiatric conditions. Yeah. So if it gets beyond my scope, I'll definitely refer them to you or another psychiatric provider. And the point where it gets to that is where I have a patient who I've been managing with a certain medication or certain treatment, and they may not be responding to it, or it's not working for them, or they feel like they're getting worse, or they may need multiple medications. And I think it's more safe and better to manage it with a specialist. I may send it to a specialist because it's better for the patient. Or if they have a lot of psychiatric comorbidities, multiple, I think it's better for the patient to have a specialist like yourself, whether they have complex PTSD, borderline personality disorder, bipolar disorder, schizophrenia. It's better for a primary care physician not to manage these cases. But if you're a patient who's, having a difficult time in your life, you may be having panic attacks, difficulty sleeping, anxiety, and you want someone to help you, a primary care specialist who has experience may be able to help you.
Yeah.
But I think once it starts to get more advanced and you're on multiple medications and you're showing some, complex features like psychosis or bipolar mania, these things, you should see a psychiatrist.
Yeah. And it's very important to realize that, because a lot of patients that are feeling depressed, they're having some sort of mental illness, they'll see their primary care doctor, but they won't think that they are allowed to bring this up with their primary care doctor, because, he's a PCP, he's a family doctor, he doesn't deal with this. So one message we can send to the audience is that if you are struggling psychologically, if you're having trouble sleeping, if you're getting anxious or any other trouble with your mental health, it's absolutely appropriate, and we absolutely encourage you to bring it up with your primary care doctor. That is within the scope of their practice. And like Dr. Benhuri was saying, they're very well equipped to treat certain mental illnesses. And if they're not, they're also trained onto how or when do I kick this up to a specialist.
Absolutely.
Yeah.
Absolutely. And as a primary care physician, you need to know your limits. It's very important as a primary care physician to know your scope. Don't go beyond your scope, because it might not be beneficial to the patient. You need to know what your limits are.
Yeah.
But if you're comfortable treating something and you have experience in it, that's fine. But you'd have to do what's best for the patient.
Absolutely.
But I agree with you. I
Yeah.
think if you're having mental health issues, don't feel like you can't speak to a primary care doctor. If they're understanding and they give you a safe environment, I think it's a good place to start. Because a lot of people out there are suffering and they don't know who to go to. I think primary care is a great place to start. And, yeah.
Now, we have the privilege of having Dr. Benhuri here. We got a ton of questions on the social media as to topics that they want your opinion on. So let's get started.
Sure, let's do it.